Hello viewers and learners of the course MEV 002 Environmental and Occupational Hazards. I introduce myself as Dr. Sushmita Bhaskar, working in the discipline of Environmental Studies at the Indira Gandhi National Open University, School of Interdisciplinary and Transdisciplinary Studies. Today we will discuss the mitigation of biological hazards. So in the previous sessions we discussed about the various infectious biological hazards and the mechanisms through which the biological microorganisms are transmitted. It could be through human to human contact, through infectious body materials, through the blood, or through the vector-borne diseases and so on. So now let us see how we can follow certain protocols. It could be even by the using of the personal protective equipments, and how we can mitigate such biological hazards. So after learning and listening and learning this module, you will be able to list the levels of the biological hazards, explain the control measures of biological hazards, describe the measures for minimizing the risk associated with biological hazards. So the levels of biological hazards. We know that the biological hazards are coming from the organisms that are harmful to the health of the human beings. And the severity of the biological hazard depends on the type, the location and the amount of that microorganism's toxin which is released, as well as how far the affected population size is, the density of the people that are inhabiting an area, and also the characteristics of that area. So it is because of all these reasons that different microbes can cause different diseases. It could be epidemics, it could be pandemics with varying levels of severity. The relative severity of the disease caused by a microorganism, that is the ratio of the clinical cases to the number of infected hosts, that is known as the virulence. There are 4 different levels of the biological hazards. Level 1. This level is usually bacteria that are relatively harmless to the humans. The best way to protect ourselves from this is by wearing personal protective equipments. Following proper hygiene is also a prerequisite to fight against any kind of biological hazard. Washing hands frequently before and after meals, after going to the washroom, these are all some kind of protection things that we can take for ourselves. The most common level 1 biological hazard is, for example, hepatitis, chickenpox and also E. coli. Level 2. This level of biological hazard are usually those bacteria or viruses that cause the mild symptoms in the humans. Little care is required to make sure that you don't become infected with any of these bacteria or viruses. We must of course wash our hands frequently, wear the PPE, and so that we can protect ourselves from these hazards. Examples of the level 2 hazards include salmonella, measles, Lyme disease, influenza and also the human immunodeficiency virus. Level 3. This is now a step further. This level of biological hazard can have severe or fatal symptoms in humans, but it can be treated by vaccines and also certain other immunization measures. Strict precautions must be taken to avoid these level hazards. It includes special equipment and protective gear that is used to prevent the spread of such infectious agents. Now, if these are not contained properly, an outbreak can occur and they can kill several people, which can result in epidemics. The examples for this level include anthrax, the SARS virus, tuberculosis and so on. Level 4. This is the worst form of the biological hazards. This can result in severe illness or death in humans, and at present this has no vaccine or any treatment that is available. People working around these type of viruses are required to wear full body suit to protect them from the harmful viruses. Again, it is necessary to wear the oxygen mask to avoid breathing in that area of the bacteria or viruses. For example, there may be doctors, nurses and other the health officials and healthcare workers who are working with such infectious bacteria and virus even in the laboratory and also in the field when they are treating such infected people. The most deadly disease of this level, the examples include Ebola, bird flu, Bolivian and the dengue fever. So these are the worst forms of the biological hazards. So now that we know the levels of the biological hazards, are there any control measures for the same? We have learnt in the previous sessions that according to the level, the biological hazards can cause infections, it can cause allergies, toxicity and other diseases in the human beings. Therefore, it is necessary to take some measures that can control these hazards. The source of these hazards can vary from indoor to the outdoor surroundings. There are certain hazards that take place at the workplace, and that the risk may be even higher. Similarly, the outdoor workers who work with animals, healthcare workers and others who are exposed to the human body fluids, they are likely to be at higher risk of exposure to the biohazards than the workers in other occupations. Controls for biohazards are relatively high for the workers exposed to human bodily matter, laboratory cultures and the biohazard waste materials, sewerage and rubbish, but relatively they are low for the workers who are exposed to animal and the animal products. So the level varies. The control of the biohazards, this requires systematic and analytical approach that considers the nature of the biohazard agent, the workplace, the nature of the work and also the worker type. The nature of the control mechanism, again, this will depend on the type of the agent, its mode of transmission, virulence and infectivity, the nature of the task and the methods of exposure, the number of people who are potentially exposed to the hazard and their susceptibility also to the biohazard. As with other hazards, the priority for control is the elimination of the hazard. We try how best we can eliminate the hazard from the source. So this may be by eliminating the source of the biohazard, eliminating the biohazard agent, for example using pesticides to eliminate the pest vectors, eliminating the vector, like there are several vector species that are transmitting certain infectious diseases. So maybe we can eliminate the vector using vector species that act as a precursor of several diseases. Now basically there are three approaches for controlling the biohazards. The first one is to look at the engineering controls. If a hazard is not controlled or treated by the engineering method, then we can go to the next step, the second one, which is also referred to as the administrative approach. If still the hazard persists, then the last option is to wear a personal protective equipment. Along with this, warnings are also given to the people and the public. Proper waste disposal is also maintained, and training and awareness can also be taken up in community level and in the entire district and national levels to minimize the effects of these hazards. It is generally observed that most of the workplaces are most likely to provide the workers exposed to biohazards with the protective clothing. At least they are also likely to be provided proper training for these hazards. It has been observed that the workers who are exposed to the living animals are hardly provided with any protective device. So this also needs to be done up and also followed properly. In this view, the health professional has an important role in the management of the biohazard by working with the healthcare and occupational health personnel to ensure that biohazards are systematically addressed in occupational health and the safety management processes. So first, coming to the engineering controls. These are the first line of defense and include built-in protection in buildings, working areas, equipment and supplies. Hazard protection is built in and therefore controls are in the design stage. Examples are the ventilation systems, construction seals to create negative pressure rooms. Also, partial isolation of the contamination source can be done. Installation of negative pressure, separate ventilation, AC system, air conditioning system in the medical wards for the infectious diseases, and the use of the ultraviolet radiation lamps that can also help to prevent the spread of the contaminants. So these are all the engineering control devices that can come into place. Now engineering controls are of two types. You have the non-ventilation and the ventilation. Non-ventilation control have the capacity to reduce or eliminate the process emission rate. For example, the use of well-fitting lids to liquid containers. This can range from the enclosures, the seals, jigs and also the handling aids. Now unlike the non-ventilation control, the ventilation is unlikely to affect the emission rate from a process. Rather, it is designed to control the contaminant once it has been released. Ventilation controls are probably the most widely used method to control the airborne contaminants at the workplace. Next comes the administrative controls. These are steps in the work procedures or the work processes that minimize the risk of exposure to a hazard. So this does not eliminate a hazard, but significantly it can reduce the risk of injury. They are set up by the management and workers are affected if the hazard cannot be eliminated or reduced through the engineering controls. Specific work schedules are required, rotation in shift can be done. Along with this, the workers' training, spreading awareness and organizing workshops can help to protect the workers and oneself from the effect of the biological hazard, especially at the workplace. Finally, coming to the personal protective equipment. When a hazard poses a threat, even after engineering control and the administrative controls are in place, and even then if it is not effective, then we need to wear the PPE kit. These equipments are worn by the workers to minimize the impact of the radiation, the chemicals and the biological infectious agent. Working in hospitals, in labs, clinics, industries, all this require safety special clothing against the biological hazards. Always you would have noticed doctors and attendants, they wear masks in the hospitals, and the workers wear helmets in the construction or the mine department, and they wear goggles if they are working with the light in the welding equipment areas and so on. So for the personal protective equipment to be effective, it should be worn comfortably, and the workers must also be trained properly as to how to use them in the proper way and to be effective. Now these are some of the equipments which are commonly used. Surgical mask. This generally consists of 3 layers of non-woven fabrics. It provides a barrier protection against the large respiratory droplets. This type of respirator filters out the particulates and liquid droplets in small particle size. Therefore, it provides protection against aerosols and the airborne microbes. The selection of particulate respirator should also consider whether the work environment contains oil, mist or fumes, and the required filtration efficiency that is required for the protection level. Powered air purifying respirator. This type of respirator uses an electric blower to bring the air through the filter to the air to user, so that it is making it more comfortable to be worn. Air supplying respirators. Here clean air is supplied by air compressor or high pressure cylinder through a hose. Goggles. Safety goggles and glasses and face shield can protect the eyes from contacting the pathogen carrying blood, blood droplets or other body fluid, which may then enter through the mucosa. Gloves. Gloves are used for protecting the hands from contacting the blood, the infectious droplets, body fluids and other body tissue of the infected or pathogen contaminated objects, and can avoid the infection when we touch the eyes, the mouth or the nose afterwards. So gloves can protect the open wounds from contamination by the pathogens. Most of the gloves that are being used now is a one-time use glove, that is we can use it and then it can be disposed after every use. Just like we are protecting the eyes, nose and the mouth, the shoe covers are also in place. So shoe covers, they prevent the pathogens from being carried outside the workplace. Now if you have ever visited the ICU, the intensive care units of hospitals, specifically they mention that your shoes need to be taken out, and they give you the special chappals or the slippers, and over that you can also wear the shoe covers. That is disposed after one time use, after being used once. So these are usually disposable after use. The boot covers also, they can offer further protection, and it should be taken that these are tight fitting, because if they are loose then there is a chance that you can trip and fall. So they should be water resistant, they should be properly fitting, and they should also be skid proof so that it does not hamper the movement of the person. Workplace hazardous materials information system. So the suppliers of the products that are hazardous, they should have this label on their the bottles that they are supplying, or even certain E. coli or other kind of the microbial agents and the vials that are used. Even the immunized and the vaccines also, all this should be written, as you know, they should have the biological labels in place, and the workers who are handling such products also should be educated about the hazards of such hazardous materials in the workplace. It's not only the biological material but also the chemical material which are used in the workplace. Minimizing the risk of the biological hazard. So how can we minimize the risk? Densely populated residential areas, the crowded business district, tourist attractions, all this are at increased risk from the biological hazard, because there is closer human contact and potential for the increased rates of the transmission. So that is why whenever there is a pandemic or an epidemic, the guidelines are issued by the city headquarters, when there are only 50 people can be allowed at one time, into one shopping complex, or only 100 are allowed for certain family functions and so on. So the densely populated areas, they need to be controlled, and we need to control the amount of the crowd who are entering your houses or the business organization, the shopping complexes and so on, so that we can reduce the human contact and maintain a greater distance between person to person contacts. Now, generally those who are immune compromised, the elderly, the young children and people who have disability and who have mobility impairment and people who have a weak immune system, they are at a greater risk for all the contracting the biological hazards and infectious agents. Wherever complete elimination is not possible, then it is recommended to control the hazard using the engineering, the administrative controls and also finally the PPE control. Now in this section what we are going to discuss, we will learn about the means by which the risk of the biological hazard can be reduced. Apart from general awareness of the masses, inadequacy of relevant policy, procedures and training, the lack of resources and so on are also some issues that are of prime concern. Although the management of biohazards is often the domain of the occupational health physician, but others who are involved must have clear-cut understanding of the precautions also that need to be taken. The proper storage and transport of the biological hazards, so optimum storage and transport, this can help in a great deal to minimize the risk that can arise from them. One must know the quantity and the facilities that are required to store the biological agents and hazards. Special conditions may also be required such as ventilation and security to ensure the minimum leakage from these agents. In order to safely transport the biological agents and hazards, special packaging will be required for the internal and external transport of the biological agents and hazards. Inactivation. This is defined as achieving a sufficient % kill commensurate with the risk. Although a 100% kill is normally required to completely eliminate the biological hazard, but the percentage kill to be achieved must be defined and appropriate methods of validation and monitoring that demonstrate what is achieved needs to be specified and to be employed. The proper inactivation and disposal of the biohazards is very important to eliminate the risk arising from them. These are the chemical and the physical methods of inactivating biological agents and hazards. Mostly autoclaving is done by, if you have seen an autoclave equipment, in this you can sterilize and you can also inactivate the biological hazards after doing away with your experimental procedures, and this does not then pose any danger to the environment. Then you can safely dispose them in the environment. The most preferred substance among the chemical method, that is potassium hydrogen peroxy monosulfate, because of its biodegradable nature. Vaccines and immunization. A vaccine is a product that produces immunity from a disease and it can be administered through needle injections by mouth and also by aerosols. So for example, the polio virus, that vaccine is administered orally. Then we have the measles and the mumps or the DPT or the TB or the BCG vaccines. These are all given through the needle injections, and there are also certain which are given through aerosols. A vaccination is the injection of a killed or weakened organism that produces immunity in the body against that organism. Immunization is a process where a person is made immune or resistant to an infectious disease, typically by the administration of a vaccine. So vaccines stimulate the body's own immune system to protect the person against subsequent infection or disease. Immunization may be useful as a control measure to protect people against infection by certain biological agent. For example, hepatitis B vaccine that can offer the protection against the infection for those people who work with human blood, and tetanus vaccine, and it is important for protecting them against the risk of the tetanus in the environment. The vaccine must be considered as a primary defense, but it cannot be considered as only the primary defense, but it is only an additional control measure. Disinfection. So apart from vaccination and immunization procedures, we can also disinfect the surfaces. Right now, for example, we are using the hand sanitizers. It is a form of disinfection. They are used for protecting us from the biological hazards, and it can be used at home, at residences, in the workplace, and they are used for inactivating the biological agents and hazard both in solid and liquid material, and you also find them in the gel form. It can be used safely on the contaminated surface and the equipment. But the effectiveness of many of the disinfectants will vary considerably depending on the biological agent, the concentration, the exposure time, pH, and the presence of organic matter, liquids or solids. So they are used as an additional control measure rather than sole means of inactivating biological agents. Safe management and disposal. Biological threats arise due to improper handling of waste generated at household and industries. In order to safely dispose the biohazards, all aspects of waste management will have to be carried out safely. That includes labeling, handling, storage, transport and also disposal. So, it is recommended to describe the nature of the waste containers that are also utilized. For example, the hazardous waste materials and the bags, the bins, the shower bins, all this should be labeled and it should be described properly as to what kind of waste is being disposed in that. Also, we should also briefly describe how your waste will be disposed, whether it is hazardous, whether it is non-hazardous waste, whether it is a biochemical, biological or a radioactive waste, and so on. Finally, health surveillance and monitoring exposure. This refers to the system of the ongoing health checkups. It becomes particular when there is a greater exposure of the people to radiations, to pollutants and also to the chemicals. Health checks are required by law for the employees who are exposed to noise, vibration, ionizing radiation, solvents, fumes, dust, biological agents and other substances that are hazardous to health or work in the compressed air. It involves preliminary and ongoing surveillance, questionnaires, interviews, examination, test, monitoring and referrals. It may also be required for the workers exposed to certain animals and animal allergens, and similarly monitoring exposure may be required for certain activities such as work involving laboratory animal allergens. Emergency procedures. The person who is in charge in the workplace, in the hospital or industries, he needs to describe the control measure and the emergency procedures that will be used to protect the people and the environment from exposure to the biological agents and hazards in case of an emergency, and also he needs to be informed immediately in case of an emergency. The primary objective of the emergency procedures is the control of the biological agents and hazards and the minimization of risk to people and the environment. Emergency procedure should be specified in standard operating procedure. It is necessary to provide important emergency procedure as clear written instructions on the display. Appropriate training must be provided to all the employees. Accidents and emergencies must be reported immediately to the supervisors, safety coordinators and the managers. Now, not only with this, but the first aid procedures which should be needed to deal with the specific biological agents and hazards in this work in case of accident or emergency, all this should be known to all the people who are involved. The training must be provided in all the relevant emergency first aid procedure. For example, contaminated clothing that should be quickly removed, the eyes, mouth, skin that should be cleaned with water, minor cuts or wounds that should be cleaned using the antiseptic soap and also immediately water in case of burns. And you must wear the PPE while treating the injured persons. So, dear viewers and learners, this was an account of the mitigation of the biological hazards. You would have got an idea of the several control measures that are required. For example, we need to work on the emergency, that is the emergency protocol should be in place, and we need to see that the engineering controls, the administrative controls and the personal protective equipments are provided to the workers and to the agents, that is the people who are working in such hazardous and infectious areas and who have also the human to human contact in case of treating the patients who have the biological infectious agents. We have also seen how certain other protocols also need to be in place. For example, the disinfection, then vaccines and immunization also can be given, and how we can boost our immunity to these infectious agents. And also disinfection of certain surfaces, the contaminants, that also can provide certain hours of the strategies for controlling the biological hazards for some time. And finally, we also need to give awareness and the trainings for all the workers in case of the first aid emergency procedures, in case if they are immediately contracting the biological infectious agents. So, the first aid procedures also are important for dealing with the specific biological agents. We also saw the levels of the exposure, like the level 1, the level 2, 3 and 4 of the biological hazards, and the examples for the same, and how the worst kind of the biological hazards come under level 4, and all these should be made known to the workers and the people who are involved in the first aid, and so that we can be able to mitigate and eliminate also the source of the biological hazard at the source itself, or give the proper treatment, and how we can handle and control ourselves also in the case of an emergency of the infectious diseases. I hope you have had a good understanding of the same. Thank you for your patient listening.